Welcome back. 8:15 right now on the Health Watch this morning. Blood banks across the country are facing critical shortages as the pandemic is keeping potential donors away. According to the New York Times, the national blood supply hasn't been this low in 10 years or longer. And here in Central Florida, hospitals in our area say they are in desperate need for blood donations. And joining us this morning is Susan Forbes from OneBlood. Always good to see you, Susan. How are you?
You too. Very good. How are you?
Good, thanks. So this is a big deal, obviously, right? We haven't seen a shortage like this in a long time, and it seems like the perfect storm. There's a lot of things going on that are contributing to it.
Yes, it really is one of the most challenging times we have faced in our history here at the Blood Center. And there's a lot of factors that are playing into it, but the leading factor is the pandemic and how it really has upended the traditional venues for our blood drives. People are not where they used to be, so the traditional locations for blood drives really are not as prevalent as they once were.
And of course, you need people to be healthy when they donate their blood, right?
Yes, absolutely. And there's a lot of people who are healthy out there, and if you are healthy and feeling well, then we encourage you to come into OneBlood to donate. We need a sustained donor response from the public to continue to come in. Blood donations are needed every single day in our community, and they're playing a huge role in helping save patients' lives.
Susan, give people an idea of why it's so important to have a good supply on hand. What does it take for, like one big thing to happen, and then all of a sudden we're really in a pinch?
Absolutely. The blood supply has to be available precisely when it's needed. And every 2 seconds someone's receiving a blood transfusion. So it has to be a proactive thing that you do and donate each and every time you're eligible so that the supply is already on hand. People who donate today, their donations will be tested tonight, and usually within 2 to 3 days of you donating, your donation's on the way to a hospital. So the turnaround is really quick, and that's why that constant need is needed.
I know you guys do incentives a lot of times, when people donate their blood. Are you doing incentives right now?
We always have donor gifts for people, and we have gift cards that are out there, different donor T-shirts and things like that. But it's a lot of frequency programs too for donors who make it a habit and continue to come back. We even launched a program where we notify you when your donation's on the way to help a patient and which hospital it's going to. So we're really personalizing the donation experience and bringing this full circle for donors.
I know that there were some rumors going around for a little while that were keeping people away from donating. One of the rumors was that if you were vaccinated, you couldn't donate. Do you want to dispel some of those rumors?
Right. If you're vaccinated, you can donate, and if you're not vaccinated, you can still donate. That does not impact your donation ability. We have a very safe environment for our donors. All of our team members are wearing masks, and all of our donors need to wear masks as well, regardless of vaccination status. So as long as you meet the eligibility criteria to donate, then you're able to come on in.
Susan, what do people need to know before they go? Where should they go for more information on locations?
Well, all you have to do is go to oneblood.org. You can type in your zip code, and you're going to see where all the big red bus blood drives are in your location and where our donor centers are.
All right.
And all blood types are needed, but there is that increased need for people who have type O blood. So if you have type O blood, be O negative or O positive, we encourage you to please come in.
All right. Always nice to talk to you. Susan Forbes, if you can help OneBlood, please do, everybody. We appreciate you taking the time to be with us this morning.